What's going on, guys? Pre-meds, pre-nurses, pre-PAs. I don't see too many pre-nurses as medical scribes, but I mean, it's really good experience. We see a lot of pre-PAs, and obviously, I'm pre-med. I'm also wearing my scrubs because anything can happen in the hospital. Anything. Patients can vomit on you, patients can bleed on you, blood can be spraying everywhere, so keep these things in mind because we are in the room. In fact, let me go over what medical scribing is. We're typing up and managing all the data for the medical chart in real time, meaning we have to follow around the physician into each patient encounter. So, I'm going to give you guys a little scenario. Ready?
Oh, hello, doctor.
What's your chief complaint today? What's going on?
Oh, I couldn't breathe very well for the last 2 days. Get worse this morning.
Oh, wow. Have you had any fevers, chills, congestion, any nausea, vomiting, diarrhea? Nausea, vomiting, and diarrhea?
Yeah, I have vomiting this morning and then the diarrhea. Oh, it come out very watery stool.
Okay, so watery stool, diarrhea this morning, and nausea and vomiting this morning. Okay, so definitely didn't have any fever?
Oh, I feel hot this morning. I feel warm.
Okay, so fever. You're going to want to write this as subjective fever. She did not take her temperature, so we don't have any number, but she felt hot. That's subjective. So have you had any abdominal pain or chest pain?
No, none of that.
Now remember, this is the HPI right now. We're starting at the... I didn't even explain this yet. We have the subjective, which is the patient story, objective, which is going to be the physical exam, and then we have the assessment and plan, which we'll get to. Do a physical exam. Stethoscope. Breathe in and out. Alright, she's got wheezing in her left lower lobe. Diminished throughout. Alright, document that. Her heart sounds good. So basically the physician's going to go around, he's going to go around and do the entire physical exam. He'll check the eyes, the abdomen, he'll palpate the abdomen, listen for abnormal heart or chest sounds, any breathing, and then also check the lower extremities, even upper extremities, maybe do some pulses. This is all part of the objective, which is the physical exam, which you're going to have to be documenting in the medical chart. You know what? We're going to do a chest x-ray, complete blood count, CBC. Just get a whole bunch of labs going and see what's going on with you right now, okay? This might be a possible pneumonia because you're feeling warm. I'm definitely going to check your labs to see if you've got an elevated white blood count. And we'll go from there.
Thank you, doctor. Oh, thank you. You're so attractive, you know that?
Thanks, man. So, you were supposed to document all that besides the attractive part at the end. What we would have had is the HPI at the beginning, the history of present illness. That's basically from the patient's point of view, but not literally from their point of view. Not like I or me, but it's patient presents to the ED complaining of shortness of breath, onset 2 days ago. She also has nausea, vomiting, and diarrhea. You can clarify like one to 2 episodes this morning of diarrhea as well as vomiting. And she had a subjective fever this morning. Now remember, we want it to be subjective. As a medical scribe, you have to know all of this. Like, you have to know all the it's like a good understanding of all the medications. I don't want to say like a complete understanding because you don't have to know it completely. And if you have any questions, remember you're alongside the doctor. You can ask him questions about that kind of stuff. Anyways, at the end we had the assessment. He was like, all right, well, let's do a chest x-ray as well as a complete blood count. You're gonna type up, okay, we'll do chest x-ray and CBC, and the patient understands the current plan. Now throughout the patient's stay in the ED, we have consults. We're definitely going to be having more consults based on the acuity of the patient's illness. And then at the end, we have the disposition, which means the patient either goes home or she stays in the hospital for an admission. She's being admitted to the hospital, to a floor upstairs. That's medical scribing. It's a lot of fun and it demands a lot of energy because obviously you're following around an emergency physician. I mean, things happen fast. You might see between 10 to 25 patients within a span of 8 hours. That's a lot of running around and that's a lot of thinking on your part because you are going to be looking at that computer screen for at least half your shift. Now, when you're in the room of the patient, sometimes, we have to obviously be really good typers. We can be looking during the physical exam and during the HPI and be typing your notes. Sometimes I do that too. I really like to see everything because remember, this is like clinical experience right here. This is it. You are really you are really seeing everything that goes on during a patient encounter. This is exactly what med schools want to see. In the last 2 years, medical scribing has sort of been on the rise, and so before that, it wasn't really considered clinical experience at all. You would still have to do volunteer work to get your hours for clinical experience, which is kind of weird, but now I think the admission boards are finally realizing that, hey, I guess they are sort of seeing patient interaction, and I guess they are sort of like shadowing a physician. Yeah, we're alongside a physician. We're pretty much with them during their entire shift, like I said. So it's really good experience. A lot of us are in our gap year. I decided to take a gap year, so this is what I'm doing during it. It's not very good pay. That is a huge con. But the huge pro is just all this experience that you get. I mean, it's absolutely enriching. You learn so much. And you know what? Maybe it's good for you, maybe it's not. Well, I mean, maybe you'll work for a couple of months and you won't really like it. Now you know that's not the field for you. But I guarantee if you guys are going to be applying for a medical scribe job locally, I really think you guys are going to love it. You're going to put it onto your application. Med schools are going to see it. It's really good experience. So let's go over some pros and cons. You're working alongside a physician, which means you can be getting letters of recommendation. Again, like I said, you're getting really good experience, and it pretty much opens up your world to emergency medicine. Obviously, you can relay that to primary care, pulmonology, cardiology, neurology, because you are seeing all the teams based on the patient's case. Because doctors are going to be talking to those other specialties too during their consults. In fact, you might even see them in the ED if they work at that same hospital. It's really cool, honestly. Some cons, not very good pay, which is totally fine. I mean, I would work the job if it were just volunteer work, to be honest, because of how much experience you get. Another con, I can't really... Oh, the shifts are 8 hours long. You don't get any breaks, which means you have to bring some snacks. But again, I mean, you are going to be really hungry, you're going to be really tired after your shift. But you build up the stamina, which is great, especially for when you go into residency later on in your life. I mean, that shit's intense. So that's medical scribing. I'm going to be putting out more videos and other things, trying to help you guys out. I'm pre-med too. I'm on the same career path as you guys. But yeah, until next time, guys.